Okay, the next slide then talks about how to control a gag reflex. This is very important, ladies and gentlemen, because you actually do encounter quite a number of patients that have gag reflexes in our practices, particularly with children as well as our older population. And these are the people that normally require dentures. So please just be patient with them, understand, have sympathy, and deal with it accordingly. Okay. So according to your slide, then you're going to work quickly and with self-confidence. You need to be very, very fast because yeah, they react very terribly, and it depends on the severity of the gag reflex. So then in some situations, depending on how bad it is, you will use surface anesthesia on a cotton pellet. So we will basically be making use of a topical anesthetic on a cotton pellet, and then you're going to rub it especially in the palatal area. Né? Sometimes we have to go, if a topical anesthetic is not available, we have to go as far as actually injecting the patient palatally. This is very painful, but if there's no other way, then we have to inject the patient palatally before we actually take an impression. And then from there, the optimum material in a tray must be a stiff mixture. If you remember last week's presentations, we talked about how using alginate and water, we can manipulate the consistency of our mixture. So obviously in such a case, maybe you might have to either add alginate or reduce the amount of water to get a stiffish mixture, so that we can get it into the mouth, because the moment it's runny, if they just feel the material at the back of their throats, you see. So try and make a stiffish mixture, but work fast. The key here is really just to work fast. Then from there, we're going to ask the patient to slowly breathe through the nose and ask them to concentrate. So try and like get them to be distracted. You like think of a happy place, or let's count up to 10. Like in private practice, you just think of funny stories just to get the patient off their minds from the impression material that is in their mouths. Then from there, the patient upright, head slightly forward. Sometimes you'll have to then tell a patient to, now I'm going to put the material in your mouth, breathe through your nose and just relax. If needs be, if you feel like you want to just vomit, then you just tilt the head forward, then just ask them to breathe. This just elevates the pressure up until you get an appropriate impression. And then from there are home care instructions for a full denture. Please guys, study them. These are very, very, very important. It's your bread and butter. I'm not going to go through all of this because I've already touched on it earlier on. So this is very important. And then from there, so this is there's ones for a full denture, there's ones for a partial denture. Please know both of them. And then from there, we're going to go on to immediate dentures. So immediate dentures are still a type of prosthesis. Immediate dentures, you can still make just a partial denture or a full denture, both of which are removable. The only difference is with an immediate denture is that the patient comes, let's say they have severely carious teeth or periodontally involved teeth. So now for aesthetic reasons, mainly, they do not want to walk around edentulously because it takes about 6 weeks for healing to occur. Né? So in such a case, then we'll have to extract. When the day that we extract the teeth, the appointment where we extract the teeth is one where we soma place the denture in the patient's mouth. Né? Does that make sense? Whereas, for example, in the setting that we've described previously, the patient has already undergone healing, teeth have already been extracted. All you just have to do is actually make the denture. In immediate dentures, teeth have not been extracted, but we still have to make a denture that the patient will leave with immediately. Né? So, like I mentioned before, they say placed immediately after extraction of a patient's remaining anterior teeth. This need not be specifically anterior teeth, but teeth and teeth. And then the denture serves as compress and bandage to protect the surgical site. So with immediate dentures, the patient comes in, let's say Mr. Martin comes in again. Our patient comes in, we see that they require dentures, but for whatever reason we want to maintain the surgical site, or for aesthetic reasons, like he's a professional, we need to maintain teeth. So in this one, we take impressions beforehand. We take the shade beforehand, then we send them to the lab, for example. Then the lab makes a denture as though the teeth have already been extracted. So when that comes back, when the denture comes back, normally it either comes back in wax if he wants you to take measurements, which is not really possible most of the time because the teeth that you want to remove are still in the patient's mouth. or the final product comes back. So let's say theoretically now the final product comes back with the teeth that we are still going to extract, né? Then we call our patient back in. Then from there we extract the teeth, extract. The moment we've done extracting, we take this final denture, we put it into the patient's mouth. You see, so the moment we take the teeth out, we put something in, and then we give the appropriate instructions for the patient. With immediate dentures, then obviously we will do multiple recall visits. Like after 24 hours, if there's like pressure spots, then we'll have to elevate them. We'll check how the surgical site is still going. If it's healing nicely, we don't interfere with it. Even when the patient left the first day, the day we put in our dentures, we would have instructed them to not remove the dentures for the rest of the day up until they come back to the dentist the next day. Does that make sense? So we took out teeth, we put in a denture, we tell them not to remove it for 24 hours. They'll only remove it when they are back at the practice. Then after that visit, they're gonna come back after a week, then probably after 6 weeks, because we would have told the patient that, look, between 6 weeks and 6 months, because healing is going to occur where you took out your teeth, where you extracted your teeth, it's your denture is not going to fit anymore. It's going to start being loose because now healing has occurred, né? So it's then when they come back that we'll then have to assess whether we have to reline the denture, rebase the denture, or make a completely new set of dentures, né? So that's basically what happens with immediate dentures. So with dentures, so now let's say after 6 weeks healing has now occurred, the patient feels, all right, no man, my denture is loose, let me go back to my dentist. Then let's say we decide on a denture reline. So a reline basically is accomplished by placing a new layer of denture resin over the tissue surface of the prosthesis. So basically we are taking the same denture that we did the last time, but we're just going to add a new base, a new base, one that adapts better to this alveolar ridge that has now healed. Does that make sense? So the impression is taken with the present denture used as an impression tray. So we're going to actually place material inside of the denture, and then we actually take then an impression using the existing denture. Okay, and then the patient is instructed to close in normal occlusion. So we're going to put it, and then we're going to take it out after the impression has set. And then the denture and the written prescription are sent to the dental lab for relining. So once the impression has been set, we're going to remove it from the patient's mouth. Then you are going to write in the technician's book what you guys want. You're going to probably write please reline denture, and then you're going to send off to the technician's lab. Then you're going to tell the patient that we'll either call them or book an appointment so that they can return and get their new dentures. Okay, then from there we're going to talk about handling visco gel. So visco gel is used as an on oral tissue that has been destroyed by chronic trauma and infection. It is applied during the placement of immediate dentures after extractions, and also can be used as a liner for patients that cannot stand or handle a denture. Sometimes when also like a denture is a bit mobile, let's say after an immediate denture, you can actually, if it's not severe obviously, then we can just place visco gel on the resin base of the denture, and then allow just the patient to place that in there, and then they can go about their lives. Okay, then from there it can also be used as a functional impression material for relining and rebasing. This again depends on the practice that you are at. Other people just use other impression materials. And from there we go on to denture repairs. So with denture repairs, let's say the denture fell. Hey, you hear stories, yeah, denture falling, my dog ate my denture, my grandchildren were playing with my denture, I was eating steak, I was at a funeral and it just broke. Woo, yeah, the stories are endless. But yeah, so a patient comes in with a fractured denture, so they're going to bring in the two pieces or two or more pieces of their denture. Normally the most common type of denture repair that you will find in private practice is then a midline denture fracture. Okay, so simple repairs can be handled in the practice using cold cured acrylics. This is possible. No one hardly does it. We prefer taking all our stuff to the lab, but it depends how bad the denture is. If it's really something minor, then we can obviously fix it in chair with cold cured acrylics. Then for complicated repairs, particularly those involving the replacement of teeth or complex repairs of the denture, are usually sent to the dental lab. So normally with denture repairs, we're going to take impressions again of the patient's oral cavity and alginate the maxillary impression, mandibular impression, as well as with the broken denture, and then you're going to write in the lab slip that please repair denture, and then you're going to send it off. Then you're also going to explain to the patient maybe how long it takes for the denture to come back, but that depends from practice to practice. Okay, so there's an example of a broken denture in your slides. Okay, so the repair of a denture, technicians usually repair the dentures, yes, and then it comes back. Then they clean the acrylic rupture or crack. Then it's easy to repair pieces if they fit into each other. So you just see how the denture broke, and then you just try and realign those two together, using also or assisted by the alginate impression that you took, of which then the technician will make a model of, so that he can actually repair the denture. And then in case the denture does not fit, we may have to take new impressions. I've already described that. And then a metal rupture or crack is more complex because teeth and the acrylic are moved and the metal is soldered. This is now referring to the chrome cobalt dentures that I had spoken about before, that they are not that easy to replace. So if by some shocking reason it broke or whatever, then we'll have to take it to the lab. If they feel that the metal can be soldered and repaired, then they will do so. Other times, unfortunately, we will have to then fabricate a new one, but it's more expensive and more complex. So success really just depends on your lab technician and where and how the denture fractured. Then we go off to denture polishing. So a dental lathe is used to polish dentures. It needs to be disinfected after every polish because it's different dentures, okay? And then do not overheat the dentures, because then you will be affecting the resin as well as the shine. And then normally the dental lathe sometimes leaves fabrics on the dental resin that are a bit difficult to remove. So it's very important for you to not overheat the resin. And then from there, we're going to talk about overdentures. So overdentures are dentures where implants become anchors, and they're very retentive and stable. So overdentures, obviously, because implants are involved, tend to be much more expensive. So depending on the patient's motivation and financial status, that will basically determine if the patient gets an overdenture or not. So then, instead of having abutment teeth, we're going to use implants as abutment teeth. I've also seen cases in private practice where patients actually still have roots in their mouths, and then dentures are just placed on top of them and still classified as overdentures. But let's stick to this example with our implants. So they're very stable, they're very retentive, and can still be removed once in a while to actually help the patient examine the denture and clean the denture and take the denture for repairs if necessary. So overdentures are very useful in that regard as well. Then having implants around the residual alveolar ridge helps maintain the integrity and the volume of the residual alveolar ridge in the cavity. Okay, then from there, okay, so then the last slide talks about the practical skills outcomes. Guys, please use your outcomes and your learning outcomes as a way to study. But that's that. When it comes to removable prosthetics, please know full the types of prosthesis. Please know the terminology. Please know your role in all the steps and visits that you will be involved in. Know the materials that you will need to use and when they are needed, equipment and materials that you will use and when to use them. But I think that's that when it comes to removable dentures. Okay, I hope you guys enjoyed. If you have any questions, comments or queries, please feel free to email me. But as well, since we are using YouTube as a learning source, please do not hesitate to actually ask questions beneath the YouTube video that you will be watching, so that I can just assist you accordingly. That will be the best way, so that I can just answer you immediately. But even Gmails are also fine. Okay, so use technology that is there at your disposal to study and get some clarification. Okay, I hope you guys understood and enjoyed. Mwah.